Surgery on meniscal tears is the most common orthopedic surgery done today. I had a surgery on my right knee over 10 years ago, and today I want to talk to you about it so that you can avoid it. Meniscal tears are incredibly common. About 30 to 40% of people will get a meniscal tear at some point during their lifetime. But that doesn't mean it's going to be a big deal, because most tears are small and don't require surgery. And physical therapy can fix most meniscal tears. Over 70% of people improve or their pain completely resolves with physical therapy. But the problem is compliance. Many people don't like going to a therapist on a regular basis, which is why understanding the problem is so important, because otherwise you'll be seeing me for injections or a surgeon for surgery. Think of your meniscus like a little cushion, like a little pillow between the two bones of your legs. And due to some kind of an injury, due to a sudden twisting, turning motion of your knee, you get an injury, you get a tear. Knowing the size and location of the tear is important, which is why MRI is so crucial, because it will let you know where it is and how large that tear is. Meniscus is also divided into three zones. There's the red-red, the red-white, and the white-white zones. And the zones are divided this way because of the circulation, or how much blood each zone gets. And the more blood it gets, the more healing potential it has. So the red-red zone is on the outside part of the meniscus. And if it gets a tear, it will likely heal. The white-white zone is on the inside part of the meniscus, and it will not heal if it gets a tear. Think of it as white, of the person going white when they're about to faint, and the same thing of your meniscus. So white is not good, because a tear in the white zone, it will not heal. The other important factor is the shape of the meniscal tear. Is it a radial tear, straight through? Is the tear on the periphery? Is it something a surgeon can repair, which is very important? Combining these two factors with the person's symptoms will let me know, is it mild? Is it moderate? Is it a severe degree of a tear? Will the person respond to physical therapy alone? Will he or she need regenerative injections? Or do we need to skip these two steps and send the person straight for a surgical consultation? The great majority of people are going to get away with physical therapy alone. But for other patients, it's not going to be enough, and we will need to go to the next step, which is prolotherapy or PRP injection, which is your own blood injection. So in this step, we take your own blood, spin it around in a centrifuge, and take out the platelets, with the growth factors, which is the rich blood full of the healing potentials, and re-inject it into the injured area. And magic happens. It heals the injured area. An area that otherwise would have no potential of healing can regenerate or regrow. Now, this doesn't heal the white zone tears, because it doesn't work for such an area that otherwise doesn't heal at all. But it does work in the red-white zone and the red-red zone. It accelerates the healing, and it heals it to an extent. This injection acts like a reminder for your body. Come in, heal this area. We need you to pay attention to this meniscus to heal it. So these are the conservative options, the regenerative injections and the physical therapy. Now on to surgery. If these options fail, or if from the beginning the meniscal tear is too large, too severe, then surgery is your next best option. And this was the case for me over 10 years ago when I was diagnosed with my meniscal tear. And it's important to know that in most cases, if the person is young, healthy, and active individual, surgery is actually the best treatment of choice, because in most of these cases, they will return to regular activity within a matter of weeks after the surgery. But of course, it has to be the right kind of a meniscal tear and the right kind of a patient. So please like and subscribe and have a great one.